1450, FM 99.3 KNSI. Welcome back to Your Health, produced in association with CentraCare. It's flu season. We're going to be talking about influenza and flu shots. What is influenza? How is it transmitted? How is it diagnosed? What are the symptoms? How do you treat those symptoms? And most importantly, folks, how can we decrease our chances of getting the flu? Family medicine physician Dr. Jay-Sheree Allen is our guest today. Dr. Allen, it's great to see you again.
It's great to see you, too.
So the flu, 'tis the season, right? There's not much we can do again.
The season. We are here. Did you hear that 4 cases have already been diagnosed?
Yeah.
Was it Wadena like 2 weeks ago?
Yeah,
or so?
I'm not surprised. And in fact, there were cases before that are even starting to show. Is this early or not?
No, this is the season.
Okay.
The season.
All
We're
right.
in September.
Well, influenza, the flu. Oh, I've got the flu. I'm vomiting. I have diarrhea. Wait a minute. That's probably not influenza.
So influenza is a respiratory viral infection that's easily, as you know, spread from person to person. So causes symptoms such as fever, headaches, body aches, sore throat, and cough. Can also cause very serious respiratory complications and puts people at high risk for developing really bad pneumonias, as we've seen in prior years.
Yeah, I have known people, hey, have you got your flu shot yet? Oh, I'm not going to get one. Have you had the flu lately? No, you're very lucky. Get your flu shot when the time comes. This stuff is nothing to fool around with, is it?
It is absolutely nothing to fool around with. You should get your flu shot.
All right. The transmission of influenza.
Yeah.
Not so long ago, we were talking about, coughing into your elbow as opposed to coughing into the palm of your hand. How is the flu transmitted?
Yeah. So the virus, remember, it's a viral infection.
Right.
So it's the virus is in your mucus and in your saliva and can actually spread to others when you cough and when you sneeze. So that's why I don't want you coughing into your hand because you touch stuff, right? You touch other surfaces, doorknobs. And believe it or not, some of these viruses can actually live like 2 hours or more on like surfaces, tables and stuff. Yeah.
So literally every morning when people come to work here at the radio station, and it didn't used to be that way, but we have Clorox wipes, right? I'm just going to drop that name, Clorox wipes. And we literally wipe every surface down. The control room counters, the key. Look how gross these keyboards are. That's just literally the tip of the iceberg of things that should be wiped off. When you go to work and you go, oh, I have to go get a cup of coffee. Think of the things that other people have touched before you got there.
And that brings us back to wash your hands.
Right.
Wash your hands with soap and water at least 20 seconds or an alcohol-based sanitizer.
Now, as we wash our hands, that slipperiness of the soap, the friction of rubbing your palms of your hands and the backs and right between the fingers. Exactly right.
In between.
So that friction gets rid of the germs, has them lose contact with your skin, and the soap, the slipperiness, washes it away.
Yeah, and another part we're forgetting, underneath the fingernails.
Right.
Yeah, you harbor a lot of bacteria under those nails, too.
Usually, and again, I'll go back to the fact that I grew up on the farm, and when we would come in, it would be time for supper. There was always a little brush right there, right by the exactly right. Yeah. So do that. Don't forget about that kind of stuff. You mentioned an alcohol-based hand sanitizer. Do they really work?
They do, to kill the virus. Yes, they do. That is why we promote them.
All right.
So yeah, and you'll see them too, even in just like supermarkets now. Right. They have them kind of at the entrance way, and at your doctor's office, they're in every single room. And
think about this, because I don't do this. There are also wipes now when you get to the grocery store, because you're going to put your hands in the very same place the person before you did. And of course, they were following proper hand hygiene, weren't they?
Oh my gosh. So no, you've got to take all precautions necessary. Honestly, wash your hands. We can't stress that enough.
Are we being germaphobes?
No, we are not being germaphobes. You do not want to contract this virus at all. We're not being germaphobes. I think we are practicing really good hygiene habits.
Let's make sure that people know the symptoms of the flu.
Yeah. So the flu, it tends to start suddenly. It's, not one of those I've been getting sick for 5 days.
Right.
It doesn't really. Most people can remember when they were well, and then they're like, and it just hit me like a ton of bricks is what I hear a lot.
Or a truck, right?
Yes.
So it's like 10:15, boom.
Yep. So I've had patients who could tell me the time, but the things that happen, the chills, the sweating, the fevers, like they'll say my body hurts is what I get a lot. Like all my muscles hurt. Yeah, total ache. Just feeling run down, tired, the runny, stuffy nose, headache, sore throat, cough, they all go along with it.
All right, very good. When it comes to the flu and their symptoms, and we're talking about influenza now, okay, the respiratory, that's the real flu, okay? How long do those symptoms last?
So typically 3 to 7 days around there, but it also depends on how healthy you are as an individual, right? But typically 3 to 7 days. You should probably start feeling better after like the second day or so. After 48 hours, things should be improving.
Okay, if I notice I have these flu symptoms, do I have to go to my doctor to see if I can get some type of medication to make me feel better?
So it depends, right? So it's very important to know your underlying health status, right? Are you a fairly healthy individual with, on a good day, normal vital signs? You really don't take much in terms of medications. You don't have a lot of diagnoses, right? And you can control some of these symptomatically at home, whether it's through, and we'll talk about those later in the segment, versus if you have underlying medical conditions that are quite severe, lung problems or breathing issues, right? You have heart problems. You take a lot of pills for a lot of different things. Even worse, you're immunocompromised. So you're taking medications that are suppressing your immune system. You absolutely need to come in to see a doctor, especially age is also really important, right? I really worry about my patient population, especially over 65 and my babies. So that's really important.
All righty. Very, very important information when it comes to influenza. We're not even going to call it the flu. We're going to call it influenza, its proper name. Dr. Jay-Sheree Allen is our guest. We are going to take a break. When we come back, diagnosis, treatment, prevention. You can't hear this information enough. It's flu season, folks. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Our guest, Dr. Jay-Sheree Allen. It's flu season, which is why we are talking with one of the experts. Dr. Jay-Sheree Allen, family medicine physician. Vaccines. My gosh. I know you guys don't have any kids yet, right?
No, we don't. We're newlyweds.
Wait a minute. When you do have children, what's going to happen? You're going to get them vaccinated?
They will be getting their vaccines.
Why would a doctor vaccinate their children if there's a danger? Because there's not a danger.
It is so important that we vaccinate our children, right? But talking specifically about the flu vaccine, this one is really important, and we've spoken about this before. Our review of past studies have shown that on average, the flu vaccine is about 60% effective for adults between like 18 and 64.
Okay.
And sometimes it could be less effective, right? We acknowledge that. Right. There are years where it's less effective, but sometimes more, And if it doesn't protect you from the flu, what you'd hope to be protected from is the severity of the illness. You don't want to die from complications of influenza. Now,
no vaccine works 100% of the time?
No vaccine works 100% of the time, but we do our very best, right?
How do you know?
So the flu is such a tricky, vaccine. So because the flu viruses evolve so quickly, the vaccines that we've had may not prevent the strains or protect you from the strains that are going to be more prevalent this year. There's no way to know exactly which strains will be prevalent this year.
Right.
So they make, and we have wonderful people who are well educated who work on determining which strains they believe will be prevalent this year. And that's what's used to formulate the vaccine that we're going to get this year.
Flu mist versus flu vaccine?
Yeah. So CentraCare is actually not even offering flu mist at all this year.
Right.
Yeah. So we're going to stick to the vaccine this year.
And you think about it, I'm trying to remember the whole flu mist story. Wasn't it proven to be not effective? So they are reformulated, and now maybe we can't even get it, right?
Yeah, this year we are not even going there with it. Yeah, and remember, the challenge is with this influenza virus itself. And so remember, there are different strains of influenza.
Yeah.
It will get a little too complicated at this point in time. But you hear people have people say influenza A, influenza B. But it gets even more specific than that. We start talking about the different strains in this virus. It's quite a complex virus, to be honest.
This year, I had heard that there is I don't even want to say extra strength, but for those that are 64 and above, 65 and above, there is a formula for you specifically, correct?
A high dose, yes.
A high dose,
and that's been available before, too.
Okay.
Yeah, that's been available.
So it's not a brand new thing this year at all?
No, this is not a brand new concept at all, no.
Now, how do I know? Well, obviously, if you are breathing and you're a human, you should probably get the vaccine, right? But there are some who should not
get that vaccine.
Right, little kids, babies?
Okay, so under the age of 6 months. We cannot vaccinate children under 6 months.
All right.
And that's why we encourage every woman in pregnancy to get the vaccine, right? That will protect your unborn child, right? So and you can get the flu vaccine at any point during your pregnancy, all right? So children under 6 months, we can't. Then you worry about people who've had, so they're very minimal criteria. So Guillain-Barré syndrome, I don't know if have you heard of that one too? Yeah, if you've had that within 6 weeks, that one is a big one. And then the egg allergy. So that's really important too. Small amounts of egg protein are used to make some kinds of the flu vaccine. Remember, there are also different types of flu vaccines. There isn't one vaccine, right? So that you need to ask your provider about specifically, because another thing that can be done is special orders can be made for different patients if they require a special form of the vaccine that we probably just don't keep on hand.
Well, if I'm feeling these symptoms that we've talked about, right, I feel like you just got run over by a Mack truck, should I go to my doctor?
Yes. So if you're one of the people we talked about earlier, you have, So if you're one of those people who, you're a little sicker, you have more health issues we need to be concerned about, please come in sooner rather than later. So there is a swab. Some people may have had it, and you may be familiar with that swab the nurse will do, right? Either up your nose or in your throat, and you'll get an answer really quickly, right? 20 to 30 minutes, we'll have an answer for you. And we can treat that if you qualify for the treatment with a drug called Tamiflu is what we typically use.
Right.
That needs to be taken, though, within 48, I would say at most 72 hours of contracting the virus when you're having these symptoms. It doesn't really work well beyond that.
You have set the table for my next question. We all know that our mom makes the best chicken soup in the whole wide world. But, if we've been run over by a Mack truck, we may not feel like having some chicken soup.
Yeah.
What should we be doing? I mean, I'm talking about, right, we've gone and we've gotten maybe some Tamiflu, or we've decided that I'm just going to go home and wrap myself up in blankets and drink a whole bunch of water. Is that a good thing to do?
Yeah, so supportive care.
Yeah.
You'll hear your doctor use that term all the time, right? Supportive care. So you do need to get plenty of rest, believe it or not.
Right.
You don't need to drink chicken soup per se, but you need liquids. The problem is you need to keep drinking. So take your pick, water or broth, electrolyte solutions. So that's like your Gatorades and your Powerades, that sort of thing. For kids, there's like Pedialyte,
right.
That's really good. Non-caffeinated drinks, though, are better.
Really?
Yes. Now, caffeine's a diuretic.
Yeah, but I got to have some caffeine to get myself out of bed to go to work.
You can totally have that to get yourself out of bed, but don't keep drinking that all day as a substitute for water.
And maybe you should think about not going to work.
That is true.
Right.
Absolutely true. Please stay home. If you need a note from your doctor, please come and see us.
Right.
We understand, right? And this is especially important depending on where you work. If you're around vulnerable populations, you're working around young children, you're working around older adults. Like, the flu might just knock you down for a couple days with the symptoms we talked about before, right? But it could do a whole lot more damage to people who are less healthy.
I will tell you what, if you come down with flu symptoms and you show up around here, you are ostracized. You're shunned, right? Nobody wants anything to do with you.
Oh, yeah. Have you been on a plane in the fall?
Oh, rough.
You're allowed like one cough.
Right.
Your second cough, I think everyone's like...
You know what? That brings up a really good question. Whenever I feel something like a respiratory thing coming on, I'll grab a bunch of airborne.
Yep.
Cold ease, maybe. And I'm trying to think of there's like natural ingredients in there, right? Like echinacea and those types of things.
Zinc
yeah,
and
what
all
do you
that
think of
stuff.
those?
They don't hurt. I don't know if they're going to be the difference between them being well and unwell, but you could try them. Again, remember that you need to consider your underlying health conditions, right? Some people genuinely need to come in and see your doctor. Please don't ever feel like you're bothering us or you're coming in. It's so silly. If you have concerns, please come and see us.
Quick clinics. You've got them.
Yep, we've got them. Just go, right? But the biggest thing, fluids. You need to increase your fluid intake.
I love what you said. Just go. Come on. They're there. Why do you think they have these quick clinics?
It's important.
You bet.
And also don't underestimate a little Tylenol and ibuprofen if you are able to take ibuprofen.
AM 1450, FM 99.3, KNSI. It is flu season. Our guest expert, family medicine physician, Dr. Jay-Sheree Allen. A quick break. We'll wrap up the conversation on the flu. AM 1450, FM 99.3, KNSI. Back, our final installment on influenza. You are listening to Your Health. I am Bob Hughes, and Dr. Jay-Sheree Allen, family medicine physician, is in studio with us. All right, vaccines. How does the flu vaccine work, Dr. Allen?
So the vaccine exposes your immune system to the flu virus, right? The immune system, it's your body's defense against infection.
Sure.
Right? Your body fights infections with that. So your body then reacts to this vaccine by making some special cells that can fight off this virus. Those cells are called antibodies. Yes, that's what those are called. Right. And so this is happening before you have the real exposure. Right. This is induced. We've done this to you. So when the real thing comes, your body has seen this before. It's like, oh, we know
this one.
We know what's going on here. Yeah. So that's what we're hoping for. That's the point of getting this vaccine.
Where can I get the vaccine on my body? Every time I've had it, it's in my arm. My wife prefers it in her thigh.
We typically do it in the arm. Okay. Most times we get it in the arm. Yeah, okay. If you can tolerate that.
Well, she does a transdermal patch that goes on opposite arms every other day, that kind of thing. And she's worried about some kind of interaction. Never heard of it, but she just wants to be on the super safe side.
Yeah, then I think it's important to chat with her doctor and see what's the next best site for her.
Very good. We've talked about how the whole vaccine works. But what about, we've heard this so many times. I'm not getting that flu shot.
I'll just say it for you. The vaccine does not cause the flu. It will not give you the flu. Because, so if you were exposed to the flu just before getting the vaccine, you could still get sick. So the vaccine really needs about 2 weeks to really become effective for you, right?
You can't get it soon enough.
Yeah, that's why we want you to get it as soon as it's available, right? So you want to give yourself at least 2 weeks. So if you've been exposed to the virus before and you get the vaccine after, you may still end up with the symptoms. Our hope, however, is that you don't get as sick as you would have without the vaccine.
I'm so glad you brought that up. So, and that will happen, right? People will be exposed, then not even know it. Then they will go get the flu shot, and then boom.
Yep.
So it does help lessen those symptoms, even though you've gotten the shot after the exposing.
You want to, I think it is still worth it, absolutely still worth it to get the vaccine.
All right. So, are there some side effects?
So there would be side effects from the injection itself, right? Having a needle go inside of your arm, right? So it's a foreign object piercing through the skin. So you'll get some soreness, you'll get some redness, and maybe a little bit of swelling. That, is to be expected at times. It's not the vaccine giving you the flu.
Right.
That's a reaction to vaccines.
And understand, my gosh, technology with needles, they are so much smaller than they used to be. They are so much sharper than they used to be.
Yes.
When was the last time that you had a shot that you actually felt it? I can't remember.
No, they're getting so much better now. Yeah. And then it's so quick. It's so quick, right? You know, and the nurses who do this, I mean, do it all the time. Yeah. They're really good.
And it takes maybe a day before you start feeling that little sore spot on the arm?
Yes, so sometimes these symptoms can start a few hours, and they usually last like a day or two if you do have those symptoms.
Dr. Jay-Sheree Allen, do you have any final thoughts on the flu other than the fact that it's time to get your vaccine as soon as you possibly can?
Yes. So please get your vaccine as soon as possible. And the points that we made earlier, I really want to reiterate. Wash your hands with soap and water for at least 20 seconds.
Take the time.
Take the time to wash your hands properly. And lots of fluids.
Hey, what do you think about, we talked about the handy or the wipes and stuff like that, but look over here. Here's a can of Lysol, right?
Yes.
So we do take it pretty seriously around here. Spraying the air, does that do some work? Does that work?
Sure, but nothing beats it can't hurt, but it doesn't beat washing your hands. Also, remember that these companies also sell really small sizes of these alcohol sanitizer.
Sure. They fit in the car.
So they fit in the car, they fit in your purse. Right. They even have the hooks around them. You could add it to your keychain.
Exactly right.
Yeah. So, and don't be afraid during flu season. You know, I say to my patients, I show you love, or I give you some love, but yeah.
Shaking hands is what she's talking about. And you know what? If think about what doctors do, right? There's a reason they do what they do, because they know.
Yes. And if you have these symptoms and you come to see us, please let the front desk know so we could give you a mask while you are sitting in the waiting room around other patients who are also very sick.
Nursing home visits, hospital visits.
Please delay those until your symptoms have been fully treated or have resolved.
If you have the flu, stay home from work.
Please.
And your doctor will give you a note. Yeah, but I've got this big project. Try to work from home if you can, right? Right?
We're reasonable people, and so are your bosses.
One last thing here. How long does this whole flu season last?
The season has really been extending, right? Yeah. Last year it went into spring, early spring. So I'm really curious. I'm really curious to see how long this one is going to stretch.
All right.
Yeah.
You know, and the other thing that's really cool, Christmas vacation comes around, right? And it kind of puts an end to some things for a while because the kids are not seeing each other and spreading it.
School,
yeah, makes perfect sense.
But then it picks up again.
Funny how that works, just like school. Exactly. Dr. Jay-Sheree Allen, thank you so much for your help today.
Thank you for having me. It was a pleasure.
You have been listening to Your Health, AM 1450, FM 99.3, KNSI.